Hello and welcome back, folks. Today I'm going to talk about something special, something that is making people angry since the beginning of this pandemic, and because I just found this article and I wanted to comment on it. First, a disclaimer: I'm not a medical expert, I'm an idiot, I have no idea. But I have read one or two or maybe a few hundred studies and also many articles on studies. So I have a few experiences when it comes to this. So first I'm going to read the article and then I'm going to comment on it. Ivermectin doesn't prevent severe disease from COVID-19, new study finds. Washington. By the way, this article is probably yes, CNN. Just so you know. Washington. The anti-parasitic drug ivermectin doesn't prevent severe disease from COVID-19 any more effectively than symptom management and close observation by medical professionals, according to a study published Friday in the journal JAMA International Medicine. The study enrolled nearly 500 people 50 and older who were at risk of severe COVID-19 because of their age and underlying health. These patients were treated at 20 public hospitals and a quarantine center in Malaysia in 2021. Half of the patients took a relatively high dose of oral ivermectin for 5 days, and the other half, the comparison group, received treatment for their symptoms, such as fever-reducing medications. All were monitored for the progression of the disease. There was no difference in outcomes between the groups. In fact, slightly more patients in the ivermectin group went on to need extra oxygen compared with those who took a placebo, though the difference was not statistically significant. This was the main outcome researchers studied, but they also looked at whether patients needed to be hospitalized, had to go on ventilator, needed intensive care, or died from their infection. There was no meaningful difference in outcomes between the group that took ivermectin and those who got the placebo treatment. This study had several important strengths. Okay. It was a randomized controlled trial, the gold standard of medical research, in which researchers test an intervention against a placebo. The study enrolled patients most likely to be at risk from severe COVID-19 disease, those over 15 with at least one additional risk factor and mild moderate symptoms. People who had no symptoms or who had advanced disease were excluded. Participants were enrolled only after a PCR test confirmed COVID-19 infection. It was a multi-center trial conducted at 20 public hospitals and a COVID-19 quarantine center in Malaysia between May 31 and October 25, 2021. In addition to the fact that ivermectin didn't work, people who took it had more side effects than those who didn't, and sometimes those side effects were severe, including heart attacks, anemia, and diarrhea that led to shock. The higher incidence of side effects with ivermectin in our study raises concerns about the widespread use of this drug outside clinical trial setting. Lead researcher Dr. Stephen Lim told CNN in an email. The public should understand that the highly touted safety profile of ivermectin is related to its use as an antiparasitic drug. The use of ivermectin as an antiviral in COVID-19 is a totally different ballgame, with notable differences in dosing, duration, and mechanism of actions, wrote Lim, an infectious disease specialist at, I'm not going to say the name, Malaysia. 2 previous randomized controlled trials of ivermectin for COVID-19 from Argentina and Colombia concluded that there was no significant effect on symptoms or hospitalization rates, prompting the World Health Organization to advise that ivermectin be used to treat COVID-19 only within the setting of clinical trials. Both the US Centers for Disease Control and Prevention and the US Food and Drug Administration have warned the public and prescribers not to use ivermectin to treat COVID-19. Okay, folks. So we have read this article, and most people who have no fucking idea probably think, you see, ivermectin doesn't work. Okay, number one. This may be a randomized controlled trial, but my first critique is only 500 people. Are you serious? 500 people in 20 public hospitals and quarantine centers in, what was this? June, July, August, September, October. 5-month period. 500 patients in a 5-month period. Okay? In a pandemic. Imagine that. First thing. Second, only 50 and older. Why? Why? Normally, if you test, if you really want to see the effects of a drug, you take different age groups, different backgrounds, different eating habits, and so on and so on. Oh, no. For the best case, the same eating habits, okay? I know this. But because maybe, I don't know, I'm not an expert, but maybe ivermectin in especially those people that they chose has different effects when it comes to COVID-19, as for example in people that are maybe younger, that do not have underlying health issues, and that ivermectin might helping those people. But you can't tell because they were not included in this study. Okay, next thing. This study is, you see, like for example, Dr. McCullough. He was criticizing all the time that it wasn't, that ivermectin works in comparison to those that had no treatment at all. Because people tested positive for COVID-19 and they were told to go home and quarantine with nothing. They got nothing from the doctors because doctors had no idea. They were just waiting maybe a week or two until they got severe symptoms, then went to the hospitals, and it was too late for any treatments whatsoever except for ventilators. And the critique from Dr. McCullough was that we should have early treatments for COVID-19 in comparison to no treatments at all. So, but this study says the antiparasitic drug ivermectin doesn't prevent severe disease from COVID-19 any more effectively than symptom management and close observation by medical professionals. So this study doesn't compare ivermectin to people that had no treatment, but compares it to people who had early treatment. And when it comes to this, it seems like ivermectin is working. Because if ivermectin has no difference compared to other early treatment measures, you normally would conclude that ivermectin works. You see where I'm coming from? I hope you see this. Okay. What else? I think that was it. The number of people is strange for the 5-month period, only 50 and older. Why? Then, yeah. The fact that they compared ivermectin to early treatment and not to no early treatment. And yeah. Let's see what the comments are saying. Here. Yeah, this was already well established. No, it wasn't. Well, maybe it was, but it wasn't the point, for example, Dr. McCullough was making. He was always comparing ivermectin as an early treatment compared to no treatment. Because he said for reasons he didn't understand, people weren't given early treatment help or information. This was his critique. Okay? Now, what else? You see, and people read this and they think, oh, look at this study. You see, no critical thinking whatsoever. This one is the best. Why does this article ignore the deaths? Ivermectin deaths were 3, control group deaths were 10. Most people would consider that statistically important. From the actual study, 28-day in hospital deaths, 3 versus 10. So this article, misinformation or propaganda? Why doesn't the article have a link to the actual study? Yes, good question. Where is the link to the study? No link? Suspicious, folks. Suspicious. Yeah. Don't let those idiots or CNN bullshit you, folks. What will? What do I know? You know, this is CNN. Ha 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 ha. Well, if you have any other things on this article and on the study, write a comment. If you don't like this, or this video, or my points that I made, write a comment. If you liked it, like it, subscribe, and maybe see you next time. So, see you, folks.